we get to look at complications of nephrotic syndrome. So for the complication of this disease, we are trying to say it has now gone beyond signs and symptoms, right? So this person has had this disease condition for a long time now. So how could this disease condition be affecting their system? So for nephrotic syndrome, and these are some of its complications: chronic kidney disease, high blood pressures, your blood is clotting anyhow, you know. You can also have acute kidney injury. Okay. So the major complications is, I don't want us to just list all of them. Let's just take them one by one. So blood clots. Your blood is clotting anyhow. They didn't list this edema. Okay. It should be another problem because your legs are literally becoming so heavy. Okay. So blood clots, you are losing so much proteins. And this protein should normally prevent what? Clotting. So patients are at the risk of deep vein thrombosis, pulmonary embolism, renal vein thrombosis. Like all of a sudden, a blood that is flowing inside a blood vessel could just start clotting, just stop and start clotting. Then also, you are losing so much immunoglobulins because they are also proteins. Do you understand? So your immune system is becoming weak. So you are now at the risk of developing different disease conditions that normally your immune system would have resisted. You can also pause here to look at it. It's like a rundown of, nephrotic syndrome. So high cholesterol and triglycerides, the liver compensates for low albumin levels by producing more protein, but it also raises cholesterol levels and triglyceride levels. So there's poor nutrition and growth problems. So protein loss leads to what? Low levels of albumin in the body. Your blood levels are low, so there's anemia, vitamin D deficiency, and sometimes if occurs in a child, the child system is so busy trying to tackle the disease that it forgets to grow. Okay. So high blood pressure, so fluid retention and kidney damage leads to what? There's so much traffic of blood in your body. So this worsens the kidney damage and even worsens the cardiovascular risk. And the patient's condition is just going down and down and down. So high blood pressure, the fluid retention increases it, you know, acute kidney injury because of glomerular damage. So as the injury goes on and on and on, you know, it becomes chronic. Do you understand? From acute all of a sudden to a long time stuff. So bone diseases like osteoporosis, rickets, loss of vitamin D binding proteins with the one that actually cause the bone diseases. So this is what we have for the complications, which is kind of like beyond the signs and symptoms. It's now affecting your life. Okay.